Hi, I'm Shannon Waller, the host of Social Creatures Connects. Social Creatures Connects is an interview series connecting you to subject matter experts to discuss all things social connection. Today, we are discussing social connection and mental health, and I'm joined by Divija Chopra. Welcome, Divija. Thank you so much for joining us. How
Thanks
are you
so much.
today?
I'm doing great. How are you?
I'm good, thanks. Yeah. So if you could just start out giving us a little background about yourself and your experience working as a mental health crisis interventionist, please.
Definitely. So I very recently started working as a crisis counselor, and I'm still very new to the field, but I do have also some experience in the past calling crisis hotlines on behalf of others. And throughout the whole process, there's a training process. And then when you start to ease into actually taking people who end up calling the service, it's a whole learning curve, but it's a very powerful and needed service, especially in this time.
Yeah, we thought of you immediately kind of because when we were talking about this, it's like you see a lot of here's numbers to call, here's what to do. And I wanted to kind of normalize, what I mean, the process and let people know, people like me, people like my friends and family and everyone else, what it would be like to actually contact one and what to expect. So can you just highlight a little bit like what would a standard contact go like?
Quite honestly, different hotlines, different centers end up doing it slightly differently. But what it generally can go as is sometimes if it's through, say, a school or more of a employer-based service, they'll get your own contact information. They'll just make sure that you're in a safe place, and then the conversation will essentially go, so what are you feeling? And it's just a free space for yourself. You can focus on absolutely anything that you want to focus on. The center that I work with for volunteer with is we end up keeping it a little bit more anonymous so that it's first you end up building a rapport with the person who calls in, and you don't want to dig too deeply in, so it's still again just their space. If they want to share their name, they share their name. And essentially, it's the same thing. We assess risk, assess, are you in a safe space? Are you in danger of hurting yourself or someone else? And then it kind of goes into free reign into whatever you want to talk about. We try to identify a goal, and different people end up having different goals.
Okay.
It could be help me find a resource to face, say, insert addiction here or insert substance use problem here, or could be I just need someone to listen to. I've had a rough day.
Yeah.
Or it could even go something like I'm thinking of ending my life today, and I just wanted this is my last ditch resort.
How long would an average interaction go? Just depending completely on, yeah.
Yeah, it depends a bit. It also depends on how the conversation goes. On average, it takes about 45 to 50 minutes. With
Okay.
it can be a little shorter if you feel like that you feel in a space where you can continue the rest of your day or the rest of your night.
Yeah. Okay. That's good to hear. So you touched on some of the reasons, just people struggling with addiction or maybe having a fight with somebody or whatever, just feeling low. There's a lot of different things, obviously, that can come through. Do you notice a theme, or is it just pretty much all over the place? Is there any more than others? Does it seem to be more high level situations where people are calling in or texting?
So yeah, so I was looking, a lot of these hotlines, a lot of these services post some of their data online, anonymous. And although I'm still pretty new to the field, you can definitely see a little bit of a change pre and post COVID even. And so now you're seeing supposedly fewer people who are calling in at very high risk situations in terms of, oh, I'm thinking of ending my life tonight or something along the lines. And but now you're seeing a lot of people who are calling in just because they're feeling lonely, they're feeling isolated. It's very easy to feel that way, especially in the situation we're in now.
Certainly. Can you talk a little bit about kind of the training that you went through and what the process was like and what to expect when contacting who will you be speaking with and that side of things?
Yeah. So again, it varies a little bit depending on which service you call in. The one that I volunteer with, we had a couple weeks to go through self-paced modules. So it starts out with going through like a general process of a conversation. They give techniques, some validation techniques, and it's a lot of building on everyone who joins and tries to volunteer and work for these services obviously has some level of empathy and compassion.
Yeah.
But it's trying to teach you appropriate techniques that have been used throughout the field, used throughout these services. And so you pass these modules. Typically, you have a coach who helps and is there in case you need to reach out for anything. You get a little bit of feedback on your own usage of the techniques. And then once you pass you get these like self-based assessments. And as long as you pass them within reason, then you can go on after the training session, which is typically like a couple weeks. You can go on and take people on.
That's really cool. And so what made you decide to start doing it? Was it just something that you felt passionately about, or did you hear about it, or did you seek it out?
Kind of all three, really.
Okay.
I I have experience with having people around me and struggling with their own mental health and having to call the crisis lines on their behalf. And I work in an emergency department, and especially throughout COVID, you hear a lot of people who are coming in after suicide attempts.
Yeah.
And anecdotally, I don't really know the exact data or the numbers on it, but even anecdotally, we found a lot more people coming in after March 2020.
If somebody reached out and maybe you developed a rapport with them, or they knew you, and would they ever contact again, ask for you specifically? Is it a different person each time, or how is that handled?
So with the service that I work with, we actually have the option to stay anonymous
Okay.
because of my own name and uniqueness of my name. I tend to also pick an alias,
Yes.
and so I go by an alias. And we actually, as on the side of the crisis counselors, we have no idea what their numbers are. Oftentimes, unless they're in a high risk situation, we know none of their information too.
The other thing I wanted to ask you, so this is Social Creatures, and we've always, just kind of been wondering what are social creatures, and what do social creatures do? And I consider myself to be a social creature, but I don't really know how to describe myself. So sometimes I don't know. We're wondering, I guess, from your opinion, what do you see a social creature being, or what does that mean to you to be a social creature?
Yeah, I think especially in the context of mental health and just in with the situation that we're in now with increased risk of loneliness, with increased risk of isolation, I think that being a social creature means, to me at least, kind of checking in with yourself to see if you are in a place where you're comfortable, if you're getting enough social interaction, if you're in a place also to help the people around you as well.
Yeah.
Checking in on your family members, checking in on your friends, checking in on your coworkers, even because even now everything is through Zoom, but it still leaves this distance in the middle.
It does. And I know it's not just about going out and meeting people and being around people, right? I think it's a different level of connection, empathy. I personally really love when my friends know that I might be struggling or having a good, or like a hard time, and I don't even have to say anything, that level of connectedness is something I really strive for. And yeah, I think we all need that, right? So
Yeah.
very
Yeah.
cool. Well, honestly, I just really appreciate you talking with us, and letting us know a little bit more about what this will be like. I'm hoping that, others will see this and want to reach out when needed, and understand that it's really not a stressful thing. They're not going to track your name and phone number, and, there's nothing going on your permanent record. It's a safe space to make sure that you're safe and that those around you are safe. And then from there, advice on how to proceed and get yourself feeling better, right? Great. Is there anything else that you wanted to ask me, or talk about, or just anything in general?
I don't have anything to add. I think you've touched upon everything. That it's something that initially there is a little bit of a stigma around, but it is just a safe space. It is a place where you can just lead your own, direct your own conversation and
Yeah,
try to bring yourself in. And I think it's important to also reiterate that it's something that takes a lot of courage and a lot of bravery,
I agree.
regardless.
Yeah, I agree. I agree. Well, thank you so much. Appreciate your time.
Thanks for having me.
For sure. Take care.